Welcome back to sqadia.com. My name is Muhammad Osama, and today we are talking about inflammation. In this series of lecture, right now we are going to talk about the outcomes of acute inflammation and the chronic inflammation as well. So, outcomes of acute inflammation and what is chronic inflammation and different types of chronic inflammation, which include chronic non-specific inflammation and granulomatous inflammation. So let's start off with the outcomes of acute inflammation. So we have discussed a lot about the acute inflammation, what it is, how different procedures or different phases occur in this inflammation, what are actually the manifestation of the acute inflammation, and now we are going to talk about the outcome. So are three possible outcomes of the acute inflammation. It can either result in the resolution of tissue structure and function, which is most promising outcome, and that is only possible if the injurious agent is eliminated and there isn't a lot of tissue destruction. The second outcome is tissue destruction and persistent or continuous acute inflammation. This may result in an abscess formation, an ulcer formation, a fistula formation, or a scar formation. What are these different things? We are going to talk about them in the upcoming slides. And the third possible outcome for the acute inflammation is the conversion of the acute inflammation or the progression of the acute inflammation to chronic inflammation. The conversion is actually marked by the replacement of neutrophils, which are the first respondents in the 24 hours, by lymphocytes, and similarly the replacement of monocytes and macrophages by lymphocytes as well, and plasma cells and macrophages. In the chronic inflammation, there is actually proliferation of fibroblasts and new blood vessels, which is angiogenesis, with resultant scarring and distortion of tissue structure. So in the previous slide, we discussed one possible outcome, which was tissue destruction and persistent inflammation, in which we discussed that there are 4 different types of tissue destruction. Let's start off with the abscess. So what is abscess? Abscess is a cavity which is filled with pus. Pus is actually a combination of dead organic matter and the tissue debris, as well as the different type of leukocytes that are involved in the inflammatory process. Here is a picture of an abscess. In an abscess, it is walled by the fibrous tissue to make it inaccessible to circulation so that the inflammation does not extend to the healthy and viable tissues. It results from tissue degradation by lysosomal products and other enzymes. And one of the most common causes of abscess formation is the bacterial infections, most oftenly by staphylococci. The second type of tissue destruction is the ulcer formation, and ulcer forms because of the loss of surface epithelium. Surface epithelium does not necessarily mean that it would be on the skin. It can also be in the GIT, for example, peptic ulcer, and similarly ulcers of the skin. So here you can see that the epithelium of the oral cavity or the inside of the lips is involved, and there are 2 small ulcers formed here. Now, fistula. Fistula is actually an abnormal communication between 2 organs which does not exist naturally, but it is actually because in response to the tissue destruction or persistent inflammation. Or a fistula can also occur as a communication between an organ and the outside surface as well. The last type of tissue destruction is the scar or scar formation, and it is the final result of tissue destruction and distortion in structure. And It may sometimes be associated with altered function, and sometimes there may not be an altered function. How can it result in an altered function? For example, in the previous slide, we considered, for example, there may be a physical injury, for example, a burn trauma, which can result in inflammatory process followed by a scar formation. Now, that scar would actually result in compression and actually it's actually because of the tightening of the fibers or recoil of the fibers, which results in the hypermobility of the soft tissue, and that hypermobility of the soft tissue results in impaired mobility and movement. So that is an example of how scar can result in an altered function. Now let's come on to the chronic inflammation. What is chronic inflammation? Chronic inflammation is actually the process in which, if the injury is persistent or recurrent or continuous and it is not being resolved, then the reaction is insufficient, and the process of acute inflammation is not able to sufficiently degrade the causative factor or agent such as a microbe, and that results in the chronic inflammation. There are two common types of chronic inflammation. One is the chronic non-specific inflammation, and one is the granulomatous inflammation. So let's start with the chronic non-specific inflammation. So it is characterized by a cellular reaction with a lot of mononuclear round cells, and those include macrophages, lymphocytes, and plasma cells. As we already discussed, that it is in the chronic inflammation, the neutrophils and monocytes are replaced by macrophages and lymphocytes. Then there is actually the proliferation of fibroblasts and angiogenesis. Angiogenesis is the formation of the new blood vessels, and scarring and distortion of the tissue structure. So scar tissue is also formed in the chronic inflammatory process. And there is also an interaction of monocytes and macrophages as well. How does that occur? Let's look into that in detail. So monocytes are recruited from the circulation via chemotactic factors, which attract them toward the site of injury. The cytokines, which are actually derived from monocytes or macrophages, activates the lymphocytes. And the activated lymphocytes in turn produce cytokines which activate monocytes and macrophages back. So here you can see that monocytes and macrophages are activating the lymphocytes, and lymphocytes are in turn activating the monocytes and macrophages. Beta lymphocytes are a type of lymphocytes, the activation of which results in the formation of antibody producing plasma cells. So that's where the plasma cells come from. So here we can see that there is a presence of plasma cells, macrophages, and lymphocytes. So where do they come from? The macrophages are the source of the cytokines which activate the lymphocytes. So that's how where the lymphocytes came from. And beta lymphocytes are actually responsible for the formation of plasma cells. So that is where the plasma cells came from. And the lymphocytes themselves also produce cytokines which activate the macrophages back again. So that's where the macrophages come from. So here you can see this is an activated lymphocyte. And how is that activated? It is activated because of the activated monocyte macrophage. And thus, this macrophage is activating this lymphocyte. But in turn, this activated lymphocyte is also influencing this macrophage and activating it as well. So they are both activating each other. On the other hand, the beta lymphocytes are also producing or forming the plasma cells. Now, the other type of chronic inflammation is the granulomatous inflammation, which is characterized by the formation of granulomas. And what is a granuloma? They are the nodular collections of specialized macrophages, referred as epithelioid cells, and they are usually surrounded by a rim of lymphocytes, as you can see here. So granulomas form when the immune system attempts to wall off the substances it perceives as foreign, but it is unable to eliminate, so that these harmful substances or microbes cannot damage the surrounding viable tissues as well. In terms of the underlying cause, the causative factors, the difference between granulomas and other types of inflammation is that granulomas form in response to antigen that are resistant to first responders. And what were the first responders? They were the neutrophils and eosinophils in some cases as well. So granulomas form when the antigens or the microbes or the bacteria are resistant to neutrophils or the first responders. So that's why it converts into granulomatous inflammation. And the antigens causing the formation of granuloma is most often an infectious pathogen like a bacteria or a substance foreign to the body which is not produced in the body. But sometimes the offending antigen may also be unknown, for example, in the case of sarcoidosis. Now, granulomatous inflammation involves activation of macrophages by interaction with T lymphocytes, in which macrophages are activating the lymphocytes and lymphocytes are in turn activating the macrophages. So there is a formation of these because a poorly digestible antigen which was not able to be degraded by the neutrophils is presented to T lymphocytes, which results the trigger or which trigger the results of cytokines. These cytokines then activates the monocyte macrophages to epithelioid and giant cells, which are a characteristic feature of the granulomatous inflammation. Granulomatous inflammation is also often characterized by caseous necrosis. Caseous necrosis means like cheese-like appearance with cavities. For example, as you can see here, this is caseous necrosis. And the example of conditions which involve caseous necrosis is tuberculosis, for example. Infections that are characterized by granulomas include tuberculosis, as I already mentioned, leprosy, which is a condition of the skin, histoplasmosis, cryptococcosis, coccidioidomycosis, blastomycosis, and cat scratch disease. Example of non-infectious granulomatous disease are sarcoidosis, as I already mentioned in the previous slide, Crohn's disease, berylliosis, granulomatosis with polyangiitis, eosinophilic granulomatosis with polyangiitis, pulmonary rheumatoid nodules, which is an autoimmune disorder, and aspiration of food and other particulate material into the lung. So in this section, we talked about the outcomes of inflammation, acute inflammation, and the chronic inflammation and the types of chronic inflammation, which is the chronic non-specific inflammation and granulomatous inflammation. We still have to go and discuss the tissue repair part of the inflammation. So stay tuned, keep on watching sqadia.com, and thank you very much.